The topic that I chose to present on was how fluoxetine was introduced as a treatment for depression in 1987. The history of fluoxetine began with biochemist Ray Fuller, who worked for Eli Lilly in 1963. His research included studying rats which had been treated with chloroamphetamine, which inhibits the production of serotonin, in order to look at the effects of other drugs on serotonin levels. Two other researchers, David Wong and Brian Malloy, assisted Fuller with this work. Shortly after this, David attended a lecture given by Solomon Snyder about neurotransmission. He then decided to use a technique that he learned about at the lecture, which involved grounding up rat brains and separating out the nerve endings to create an extract of nerve endings which would work in the same way as living nerve cells. Various compounds were then tested, and it was found that fluoxetine, a selective serotonin reuptake inhibitor, or SSRI, was most effective in blocking serotonin with no side effects. At first, Eli Lilly tested the drug as treatment for high blood pressure. However, in the early 1970s, discoveries began to be made about serotonin's role in depression. There was a popular hypothesis that increasing amounts of serotonin would help to mediate the antidepressant response. As a result of this theory, there were increased efforts to establish something to inhibit the uptake of serotonin from the synaptic cleft. These efforts then led to the FDA approval in 1987 of fluoxetine, also commonly known as Prozac. The drug was then marketed as happiness in a blister pack. Fluoxetine, or Prozac, is still prescribed today and is most commonly used to treat mood disorders and anxiety disorders. However, it can be prescribed for other things too. Some examples include depression, panic attacks, OCD, and bulimia.